it's time to ask it early.
Oh yeah, you've been sending us your health-related questions, and medical correspondent Dr. Jennifer Ashton is here with some answers for you. Good morning.
Good morning, you guys.
How are you? All right, let's start this off from Jake, and he asked this. Come on, Jake.
Jake, what's your question?
How do you recover from a torn ligament in your knee?
Wow.
All right, so there you have it.
Well, it really depends, first of all, what grade the ligament tear is. If you look at the knee, actually, to understand where these ligaments are, they're really on the sides of the knee as the patella attaches from the upper thigh bone to the lower bones of the leg, and also within the patella, so they go, you can see that crisscross there in the middle. Anytime the upper leg moves in a different direction than the lower leg, or you rotate, that's usually the stress that causes a ligament injury. You can get either a grade 1 or a grade 2 tear. Those are the ones that really respond to conservative therapy, and we have an acronym in medicine called RICE. A lot of people have heard it in the sports medicine world. It stands for rest, ice, compression, and elevation. And this is what any orthopedic surgeon is going to tell you to do for at least 2 weeks after you strain the joint. So this is something you can do at home. You have to stay off of it.
Yeah.
Using things like non-steroidal anti-inflammatories, Motrin, ibuprofen are a good idea. Obviously, extreme tears are going to be needed to treat surgically.
Well, that's just it. You've got the ACL, the MCL, and PCL, correct?
Right.
So any tear, I mean, are they all surgery?
Not necessarily. It depends.
No.
Sometimes an MRI is needed to be done. It really depends on how severe the tear is.
Yep.
Obviously, the more severe tears are going to be needed to be treated surgically. Physical therapy is always really important as well.
So give it 2 weeks before you make that call to your surgeon, right? Just to see how it does.
Unless it's a severe injury, yes.
Gotcha. All right, we got another question for you. This from Facebook. It's an interesting one. It's from Cynthia. Says, my hands are not really smooth like they used to be, and now my hands are really dry. Amen to that.
Right.
What can I do to make them smooth again? I think we're seeing that when we age, right?
But it's not just age, and Cynthia's question is a really common one, especially now as we're going into the colder, harsher weather months. And people confuse this. This is not just a cosmetic issue when you're talking about the skin on your hands. It actually can become a medical one, because as the skin gets dry, it can get little tiny microscopic cracks in it. That can be a source of bacteria to enter into the skin, and it is a potential for infection. So couple things you want to do. You don't want to stop washing your hands, obviously. We say that all the time. You actually want to restore that moisture barrier. I recommend just plain petroleum Vaseline. You can put them on at night. You
Straight
can put some gloves on.
Vaseline.
Yeah, it's
Can't carry anything.
that's right.
You can't be slipping out of
You
your
break
hands.
everything, but
Right,
your hands are in good shape.
That's right. So at night, it's a good idea. You can use the over-the-counter moisturizers as well, but just be careful to read the ingredients, because most do contain alcohol, and that obviously is going to be more drying. And then there's a prescription lotion called Black Hydrin that you can get from your doctor or dermatologist if the dryness is really excessive.
What I like to do is go to bed with gloves on.
Well,
Yes,
they say
I've
to do
seen
that. Put the
pictures.
lotion on and put gloves on.
And it does work.
I was kidding, but it does
There
work.
you go.
Looks weird, but it does work.
All right,
That's right.
last question
Yeah.
comes from Lindsay, who has a question many frustrated mothers have.
My question is, how do you get a small child to stop sucking their thumb?
Right. Now, my children use pacifiers. It was the same quandary in my household. The first thing is to realize that really they outgrow them. We say no one really goes to college sucking their thumb. So you really want to try to ignore it as much as possible. Otherwise, praise, reward them for not sucking their thumb, and try to keep them distracted. If their hands are busy doing something else, they're not going to put it in their mouth.
Give them a game console.
Or a BlackBerry.
Yeah, exactly.
All right, thank you, Mom. Good stuff. Dr. Jen, good to see you.